In this lesson, we'll be taking a look at coronary heart disease. So what actually is CHD? Now, CHD affects the heart and primarily the arteries which supply the heart with blood. As we know, the job of the heart is to pump blood around the whole body, and it does this via muscular contractions. These muscular contractions require energy which is released through respiration, as I'm sure you already know. Now, for respiration to occur, we need these two reactants, glucose and oxygen. In people with CHD, the supply of oxygen and glucose that can travel to the heart becomes limited, and that's because the coronary arteries become narrower. We'll go into more detail on the next slide. Patients suffering from CHD develop a condition called atherosclerosis, and this is when the arteries, as you can see in this diagram, become blocked by fatty deposits. So because these fatty deposits build up, whereby the blood was flowing through the arteries normally before, now they can't flow through the lumen as easily, and that's because of this build-up. It's caused those arteries to narrow, so the lumen is a lot smaller now. The name that we give to this fatty deposit that builds up in the wall of the arteries is actually an atheroma. Let's look at some potential treatments for coronary heart disease. So we'll start off with stents. Now, a stent is a metal mesh that's placed in the artery, and what happens is we get a tiny little balloon and it's inflated to open up the blood vessel and the stent at the same time, as you can see over here. Once the stent has become inflated like this, we remove the balloon, but we obviously keep the stent in the artery. And this holds the blood vessel open and ensures that blood can pass through to the heart muscle as normal. Now, this isn't exactly addressing the issue, i.e. the fatty deposits, because the fatty deposits are still there. All it's doing is opening up the arteries so that blood can flow through as normally as possible. Now, some advantages of stents is that they lower the risk of heart attack in people with CHD. So with CHD, the only time that it will lead to a heart attack is when the blood vessels become extremely narrow. And at that point, the heart is essentially starved of oxygen. That's when heart attacks happen. So this will be a good way of preventing this from happening. Another advantage of this is that they're effective for a really long time, and the recovery time after you've had a stent procedure is relatively quick. Some disadvantages. So, as with most surgeries, there is a risk of complications of infection. Obviously, because if you're having an invasive surgery, there's obviously going to be risks of this happening. Another one that's associated with stent surgery is heart attacks. And finally, we also have a risk of patients developing a blood clot near the stent. So when blood clots form near here, that leads to patients developing a condition called thrombosis, and that's not good either. Another effective treatment for coronary heart disease are drugs called statins, and the way that they work is they actually slow down or reduce the rate at which fatty deposits form in the coronary arteries, and they do this by reducing the amount of bad or LDL cholesterol in the bloodstream. Advantages. Firstly, by reducing the amount of this bad cholesterol in the blood, statins can reduce the risk of strokes and heart attacks as well as CHD. They also can increase the level of HDL cholesterol in the blood, and by doing this, that can actually help to remove LDL cholesterol as well. Disadvantages. Now, because they're a long-term drug and they have to be taken regularly, so let's say they have to be taken every single day, there's a risk that someone could forget to take them, and then when you lapse into significant periods of time where you're not taking your drugs, they're not going to be as effective as they would have been had you taken them on time every single day. Another disadvantage is that they can cause negative side effects such as headaches, kidney failure, liver damage, and memory loss. And finally, the effect is not instant at all. It does take time for this effect to kick in. Now, as we mentioned earlier, coronary heart disease can lead to patients suffering from heart attacks in extreme circumstances. Now, in this case, what can happen is the valves in the heart can become damaged or weakened, and obviously this is caused by these heart attacks which happen as a consequence of coronary heart disease. They can also become damaged by infection or simply by old age. As you get older, your valves just don't work as well as they would have when you were younger. Damage to the valve tissue can actually cause this valve tissue to then become stiff, and then when they become stiff they won't open properly, or they may actually become leaky as well. Now when this happens, blood flow will happen both forwards and backwards, and that's not good. When this happens, blood won't circulate as effectively as normal. Severe valve damage can be treated by replacing the valve. So you can do this either with biological valves or mechanical valves. Now with the biological ones, you can either take them from humans, so from donors, or you can take them from animals. This does have ethical issues because some religions object to the use of valves from animals, because the animals used can be like, for example, pig hearts or cow hearts, and there are religious objections to both of those animals. With mechanical valves, we kind of skip this ethical issue because they are man-made, and they don't come from animals. In terms of disadvantage, with valve replacements, it is less serious surgery than a whole heart transplant, as I'll go on to in a moment, but there is still a risk of blood clots. Let's look at a slightly longer term treatment: artificial hearts and transplants. So with artificial hearts, they're mechanical devices which essentially replicate the job of our natural heart, and that is to pump blood. They are a temporary fix. So generally speaking, people have these artificial hearts when they're on a donor waiting list, or they're waiting for a donor heart to be given to them. There's a low chance of rejection with artificial hearts, so that means the immune system is less likely to recognize these artificial hearts as a foreign object and attack it. As with most invasive surgeries, there's a chance of bleeding and infection. Another one is that you can cause blood clots and strokes. And finally, blood thinners do have to be taken. So when patients have to take drugs to thin their blood, it can cause problems with bleeding. So if they do become hurt in an accident or something like that, then they can lose a lot of blood because of these thinners. With transplant hearts, an advantage is they are more effective than artificial hearts, obviously because they are natural and they are as close as possible. They are as close in anatomy as to your original heart as possible. Problem with this is that they are in short supply, so generally speaking, waiting registers for donor hearts is really long, or are really long. Problem with this: immune system rejection. So our immune system, our white blood cells, etc., will recognize this donor heart as being foreign. So it's not our own heart, and the body will know that it's not our own. And sometimes you can have the immune system attacking this heart. So therefore, often people who get transplant hearts have to take medicines which suppress their immune system, and that can lead to other problems if they are exposed to other diseases. As mentioned before, with artificial hearts, they also have a chance of bleeding and infection that can happen during surgery. And similarly, again, blood thinners have to be taken with transplant hearts as well. I hope that video has been useful for you guys.